Hi guys, thanks so much for joining us. Hi Sarah.
Hi, hello, good morning for me.
Good morning, good morning. So yeah, where are you guys? Let us know what time zone you're in and what time you're tuning into us. It would be great to know. I'm sorry that we're a few minutes late, guys. I had some technical difficulties, so hopefully my stream stays stable and you get to stick, or I get to stick with you guys through this whole conversation. But Sarah is from the APRVT, and she's going to be chatting to us today about the neurological dog, and specifically looking at how we're going to use hydrotherapy as a tool to work with our neurological patients. So quite a cool topic, one that I think many of us get excited about because neurological cases are just so exciting, actually, to be honest. But before we jump right in, so welcome to everyone who's joining us live. Before we jump into our topic, I am going to ask you a question, Sarah, and this is related to our Vet Rehab Summit, which is based on, or which is themed around research meets reality. So Sarah, what is the research article that you quote most often, or that's had the biggest impact on your way of thinking or the way that you practice?
So that's an easy question for me. I think the biggest one for me is my first research project I ever worked on. So I worked at Oregon State University for about 8 years, and I worked on the study with Dr. Wendy Balzer, doing postoperative PT and diet changes for dogs after TPLO, or tibial plateau leveling osteotomy. And it took us 4 years to complete the project, and it was like 200 dogs going through, and it was huge. I mean, it was my introduction to physical therapy or physiotherapy, rehabilitation. It's why I started in. It's how I got my job. Purina paid for me to come work for the university and run this project and organize it and get everything going. So it was huge for me, and I'm very proud of it. It's my first published research paper. So I have a couple after that, but it's definitely the biggest one for me. And it was huge for realizing what a big difference it can make on something so simple, right? And it was based solely on hydrotherapy and diet change, and that's it. We didn't do any specific exercises or manual manipulations or laser therapy or anything like that. It was a very specific study, and we just did hydrotherapy with these dogs, and they did incredible.
Wow, that's really awesome. So guys who are just joining us, welcome. We have Sarah here with us today, and I'm going to let her introduce herself in just a moment and tell us about herself. But I wanted to just welcome you first. Thanks for joining us live. And we're here to have a conversation today about hydrotherapy for the neurological dog, but it really is a conversation. So anything that you guys want to ask or add or share, please do. We're here to chat with you, so join the conversation, chat with us. All right, Sarah, can you tell us a little bit about yourself and what you do and why neurological rehab is a passion for you?
So I'm Sarah. I'm a CVP in the United States. I have been in veterinary medicine since 2005. And I started out in just a general practice for a few years, and then got interested in moving on to doing something better. Started working at Oregon State, got a job offer to work on some research projects. And it kind of came up that rehabilitation was an option. And I have genetic lateral luxating patellas myself, and have been in PT and had all the same surgeries as all of our Chihuahua friends. And so I was like, oh, I can do this. This is awesome. So I started doing that and did research in academia for a while. I absolutely loved it. I have 2 wonderful stepchildren and a husband and a zoo of my own. So I wanted to be closer to home because I was driving over an hour to work every day. So I decided to partner with a veterinarian I've known for a very long time to open a rehab only practice in my town. And we started that in 2017. And we started out with 200 square feet in one tank and one treadmill. And today we have 3,000 square feet and 2 treadmills and 3 lasers and a shockwave and like 7 employees and seeing 40 some odd patients a day. It's insane and awesome. And I see a little bit of everything. It's crazy, spectacular, and totally a dream that I never really expected, but showed up and just ran with it, and it's been wonderful.
Wow, Sarah, it sounds like we need to be having a behind the vet rehab practice podcast. Actually, so I'm going to send you an email about that after to get that
Yeah,
sorted.
we can do that too, for sure. It's been an adventure.
So guys, I'm sure it sounds amazing, and it sounds like you've also been quite involved with research over your career.
Yeah, I have. I was very fortunate to do a lot of research when I was at the university. That was originally what I was hired on for, and that kind of for the surgery department, and then had a veterinarian surgeon who was very dedicated to physical therapy and rehabilitation, and kind of led that direction. And so I had a lot of opportunity to work with a lot of different research projects for therapy in general. So it's been really fun.
Okay, I like it. We might pick your brain on that one as well in the near future. So guys, if you're joining us live, welcome. It's really great to have you. Please let us know where you're listening from, what time of the day is it for where you are. I'm getting tongue-tied. And also, what is your interest in neuro rehab? Like, I think for many of us, the thing that excites us so much about the neurological cases is when they come right? Like when they start walking and they take those first steps, and you don't know, are they going to recover? How much will they recover? And the day they take those first steps, it's just like such a celebration. It's so exciting every single time. So what is it about neuro rehab that really gets you excited? Let us know. And if you have any questions, join us, and join in the conversation. So we have someone joining us here who says that they're not able to stop now to watch. Can I watch later? Of course you can. This is recorded and it will be on our Facebook page and in the Hydro Vet Rehabbers group. So watch later and let us know how it goes. And Michelle, welcome. I'm so glad you could join us. You will know quite a bit about neuro cases as well, don't you, on a personal level? So thank you for joining us. It's really cool. Okay, so let's jump in, Sarah. Let's start with what kind of neurological pathologies do we see most often in rehabilitation? What are the pathologies that are coming across our table, our hands?
There's a wide variety, but I think some of the most common ones we see are your typical back dogs, right? Your typical dachshunds, your long chondrodystrophic type dogs. Intervertebral disc disease is a huge one. We see a lot of geriatric neuropathies, polyneuropathies, peripheral neuropathies. Those are super common. We see a lot of geriatrics in physiotherapy. We see our acute injuries, but we see a lot of geriatrics, and I think we tend to forget about the neurologic aspect of those guys. We see a lot of traumas post-surgery, not just like I was hit by a car or I had a traumatic disc injury. We see crushing injuries to nerves after having hip dislocations, and brachial plexus injuries are a big trauma injury we see. And then I think the second most common one, or the big other most common one we see, are like FCEs, fibrocardiologous embolisms. We see those a lot, surprisingly, especially recently, it seems. And they're all very rewarding. We see some post-surgery, but we see a lot that are not surgical. And I think that's a big important thing to remember, that a lot of them are not necessarily surgical.
So Michelle's asking, is there a lot of benefit for geriatrics and what is their success? And I'd love to dive a little bit more into the geriatrics because, like you say, we tend to forget the neurological aspect of our geriatric patients. So can you expand a little bit on what we should be looking for in our geriatrics and how we need to specifically focus on that neurological aspect for them.
Definitely. I think one of the biggest things we see is geriatric connection with things like laryngeal paralysis. So the GULP is what we call it, geriatric onset laryngeal paralysis and polyneuropathy. And so we see a lot of these older dogs, they come in stiff and sore and slow to get up and down. And we think a lot about arthritis and bad hips and muscle weakness. But what happens when the peripheral neuropathies kick in, we have these dogs that have this undertone of ataxia and kind of this, I don't know where my bum is sensation. Dogs are already so front-ended, right? And then their little rear ends get really wide and they get unstable. And if we forget to work on that balance and coordination and that kind of neuro training, neuro reminding, as those muscles get weaker, as those joints get more sore and not as strong, you're left with just your reflexes. And how do you balance yourself? How do you keep moving and keep functioning? And so it becomes almost an occupational therapy and not just a physical therapy, a very specific training on how to pick up your legs, reminding even when you're tired, even when you're sore, you got to pick your feet up. And so these peripheral neuropathies tend to just be super slow and kind of on the underside. And we focus so much on pain control and range of motion and not on that balance and neuro training aspect that can be so helpful for keeping them moving for a longer period of time. And we have really good success with a lot of these geriatric dogs, really just getting them focused on specific tasks they need to do. How do they get down the stairs to get outside to go potty? How do they posture themselves? How do they balance themselves to get on and off the bed and off the couch so they're not stumbling? And, you know, it's not just weakness. There is some neurologic aspect and component with sensation that we forget. And we have to remember to do both of those to keep them going as long as possible.
I really, really love that. We actually had a recent webinar with Dr. Myra Rezendi, if I remember right, for Menton, and she spoke about immobilization syndrome. And that was one of the things we spoke about, is that our geriatrics that are slowing down are actually starting to suffer from immobility, and there's a big neurological impact there. So targeting that is so important. So I want to say hi to some of our listeners here. So from British Columbia, Canada, neuro cases are the best. Also using rehab as a tool to find out who needs to see a neurologist. Yes, absolutely. Welcome. If you guys are listening from the Hydrovet Rehabbers group, just check the description. There's instructions on how you can allow me to see who you are, because at the moment I just see Facebook user instead of your name, which is, yeah, sad. I'd love to talk to you, but yes, keep engaging in the conversation, even if I don't know who you are. Wendy says, how often do you see geriatric patients per week for maintenance? Oh, here we go.
It depends on the dog and the owner. I'm a big proponent of not necessarily just having standard protocols. Every dog is different. Every owner is different. Every dedication time is different. But usually we start with once a week, and we tend to start them really strong, where we're seeing them 2 or 3 times a week for like a month. And then we kind of wean them down to their lowest common denominator. And then as they stay effective at that once per week, maybe once every other week, depending on how much their owners are doing at home. I'm very strict about homework. And I know that's hard for a lot of clients, but I have that conversation that says, you know, if you're going to do homework at home, you don't have to see me as much. If you're not going to do homework at home, then you're going to have to see me more. So it's all about dedication, because consistency for neuro is so important. Reminding those nerves and those muscles they've got things to do, because as soon as you let it go, they get lax. So it's consistency is so important.
Right?
Don't mind my small dog in the background. He's very excited. It's early in the morning and I should be at work. So he's wondering why they're here. Walter.
Okay, So Michelle has brought up another interesting question. Do you have any small dog experiencing seizures, and do you feel that rehab improves these? Yeah, good.
I have a few small dogs with seizures. I actually have more big dogs with seizure issues right now than small dogs, and a lot of them are there for other reasons, not particular to their seizures. But I obviously managing seizures with medications or finding out where their seizures are coming from is a huge portion of getting seizures under control. But we see a lot of like endocrine diseases and stuff like that I do think really, really benefit from the consistency of coming to the clinic and having a social outing and getting physical, like very specific physical exercise that is very important for maintaining their physical health.
Perfect. Mish, let us know if that was good or if you need more information there. So we have someone else joining us. Love seeing the progress or wins of the neuro patient as they progress. So rewarding to see the owner's reactions and the patient's mojo coming back. Yes. Working with 3 neuros currently, especially rewarding having had one of mine experience neuro symptoms. Yes, I've also been there. Very scary. Learned so much from the personal experience of rehabbing him and had given me empathy with my second owners and what they're going through. It can be really valuable when we walk the road ahead of our clients.
Yeah.
It's terrifying, right, to think that we have all this knowledge and then it happens to one of our own and it's just all gone. We just have no idea what to do.
It is. I've had a dachshund who had what we call like a type 3 disc, where it was just an acute trauma. She woke up in the morning completely paralyzed, and I was like, wait, what do I do? And I was like, wait, I work where I should go. I should get up and just go to work, and I should take her with me. And I remember calling on the way to work going, I'm coming in. And they're like, of course you are. And I said, no, I'm coming in with my dog. I think she needs surgery. And they were like, for what? And I said, she's a dachshund. And they, oh, okay. And I remember just being terrified, sitting at work going, what do I do? What am I going to do? What am I going to do at home? Do I have a kennel? Do I have enough rugs? And thinking, okay, her normal routine, how am I going to adjust this to work for her? How am I going to make it in my life? I have to work 12 hours a day. Do I take her to work with me? Where am I going to put her in the workroom? And then I'm thinking, oh my gosh, my clients are going through this exact same thing. They're terrified about their dog having surgery or having this injury. And then they have to think about, how am I going to manage this, right? How am I going to put this dog into my life in a capacity that it doesn't normally stay in? And how am I going to adjust my time? How early do I have to get up in the morning to express her bladder and do her exercises and all of these things? And I need to get her on my schedule so I can have time for her to do hydrotherapy. And it's so overwhelming to think about all of that. And as I'm sure we all know, we do this all day, every day. And then you get home and you're like, oh, I don't want to do it. I'm tired. And so it's hard to do it on your own kids, and so it's very overwhelming, and it's nice to have been through that struggle. So they, you kind of have that compassion for them when they're so anxious and so stressed out and asking 7,000 questions and not knowing where to start.
Yeah. So Mish says her Daxi exactly the same. She actually took compassion leave and carried her around. But she had rehab, no surgery and a 90% recovery. Yeah. It's awesome when it works.
Yeah.
Mish, I'm going to come back to the spinal question. Wendy says, I seem to struggle knowing how often I need to see them to maintain their strength. So she asked about how often are you seeing them? Do you want to expand a little bit on that for her?
So I think that the biggest thing for me is really keeping track of their baseline, right? So when they first come in, where are they at? What's their time in the treadmill? How fast can they go? How much weight are they bearing on their own successfully? How many specific exercises can they do? And I like to give owners a sheet of successes. So what are the things they're really good at home? And how well are they doing them? And then once they have that list of 4 or 5 things that they're really good at, they are good at getting on the couch. They are good at their 20-minute walks. They're not tired. And so once I have those initial things, I usually reevaluate in like a month or so. Usually it's around 6 weeks by the time I get to it. And we see, okay, are there more things we're good at? Or are there less things we're good at? Are they better at the things they were? And those are now just normal things, and we have even better things. And then I use those tools to help me decide how often they should be coming. As I drop them down in frequency, we keep track of those successes at home, because it's about keeping pets alive longer with their owners in a happy, comfortable house. And so it's less about I can do 10 sit stands in a row than I can get on the couch the 6 times my mom wants to, get up and off the couch after dinner. And I can do that successfully. And so without mom going, oh no, do I need to help you? Or is it okay? Because if mom and dad are happy and comfortable, then they're going to be more productive with their pet. It's a team. And I think we forget a lot about the team, so they have to work together. And so you have to find those successes at home, not just successes in the clinic. And those are a huge gauge for me in determining how often they have to be there. When we see those successes at home start to lag, then we have to kind of change up. Maybe I need to see them more often and we need to change our plan. But frequently the geriatric dogs are coming once a week. And then once they get to the point where I'm hearing from my clients, we're having more than once a week struggles, I think that's probably my biggest gauge. Like, we had one bad day this last week. I'm like, okay, one day is no big deal. When we're like, seems like she's really good for 2 or 3 days after PT, and then we have a couple bad days. I'm like, okay, we need to come, let's do twice a week then. So it's really about how they're doing at home more than how they're doing with me. I mean, it's easy for me to keep track of, well, we're making it 20 minutes. Our speed's been the same. We're not, I'm not having to increase our water level because they're limpy or sore. They don't seem winded. They don't seem painful. It's about, mom saying, well, halfway through our walk, she turned around. She didn't want to keep going. Or, I had to help her on the couch for 3 nights last week because she couldn't do it on her own. Or she went outside to go potty and got stuck and I had to go help her. So those things are more important, because that's what's going to keep them at home with their family longer, is those important things that I think we forget.
Yeah, I really love that. Wendy, let me know if that helps. So really focusing on the successes at home and kind of having those outcome measures that your owner is looking at all the time, and then judging how regularly they need to see you from there and adjusting, right? It's a trial and error thing. If you're coming once a week and they're fine, then taper it to once every 2 weeks and see, and go from there. So I think that's a really good way of doing it. So guys, hi, if you're joining us, welcome. It's really great to have you. We're chatting about hydrotherapy for neurological cases, and we're really having a conversation. So join in, pitch in, share your experiences and your questions. I have another question from Mish. So about her seizure dog. She says that she felt like the meds aggravated the previous spinal injury and wondered if lowering the meds and rehab would have helped.
It's hard to say. I feel like we have to be able to manage both disease processes, right? Taking a dog that's on seizure medication and well managed and saying, oh, we're not having as many seizures, let's take lower meds, I think is a little scary. I don't want to say, oh, our seizures are gone, we should take off our meds, when our meds are what's keeping our seizures away. I would rather increase my PT time and add that in than take away medications. I do think that a lot of seizure medications will make them sleepy and tired, but we just have to try and counteract that with our activity levels and our neurologic function. That's a hard one. because seizures
Mm.
can come from so many different places. You know, are we having seizures because of our neurologic issues, or are we having seizures because of, you know, liver function, or are they just idiopathic seizures that don't really, that are all, you know, brain related and not actually, you know, anything related to their chronic mobility issues. So there has to be a middle ground between the two, but I would be very anxious about taking anybody off medication that's well managing their seizures. And I would rather add in more PT than do that.
Mm. Yeah, and it is really about like in a situation like this, it's really about the team approach. And if you feel that
Mm-hmm.
there's something that's not balancing, not working, and the meds might be aggravating something else, chatting to the vet about alternatives is a good option. Like if something's not working, let's see what other options there are. So Mish says, thank you, that's great. It's very difficult. There's a suspected lesion on the brain. So yeah, I mean, brain lesions are quite yep, they can be quite challenging to work with and
Those
work
are
through.
hard. Mm-hmm.
Not impossible,
Nope,
especially
not
if we know what
impossible.
we're doing. Which kind of leads me into my next question. So, guys, if you're joining us, please share your questions, share your cases, share your experiences. We're here to have a conversation with you. So, jump right in at any time. But, Wendy, what are some of the, no, wait, let me rather go this way. So, in terms of understanding the pathology that we're seeing, often with neurological dogs, we don't have a diagnosis, right? Sometimes we're
Yeah.
blind. How important is it that we understand and know what we're dealing with in terms of pathology?
It's immensely important because each neurologic pathology responds differently. Your timelines are different, your expectations are different. Even knowing the difference between different types of intervertebral disc disease can make a huge difference in when you start them in the water, what expectations you're getting from them, how you communicate to an owner what are reasonable expectations at this time, and what are reasonable expectations for an outcome. So we all, you know, we all kind of hear the basics like, oh, we've got 6 months for a dog to recover from a traumatic neurologic injury of some kind. I feel like that's what I hear everywhere. And, you know, I feel like that's kind of our baseline for telling owners, you know, okay, I need time because I don't know. I don't know what to expect. Anything can happen. So knowing your specific pathology, is it a trauma to a nerve? Is it a severed nerve? Is it a an internal type disease process that's degenerating the nerve itself from the inside? Because there are some neurologic diseases they're not going to recover from. You know, you are managing and slowing them down. And so knowing, is this a disc or an ischemia or like an FCE, or degenerative myelopathy, all three of them are going to look very similar when they come into the clinic. If you have an old arthritic dog and you get, and how do you know how to tell your owner, like, oh, we work with back dogs all the time. If it's just an FCE, they're going to get better in a few weeks and then we'll be good. Or an intervertebral disc dog, oh, it's going to take 4 to 5 months depending on how paralyzed they are. We could probably get them walking. Or is it a degenerative myelopathy dog where, like, this dog's never getting better? What I'm going to do is maintain this dog as long as possible. And we have to have a huge whole other conversation
Yeah.
about what our life expectancy is and all of the other things that go into neurologic disease, what to expect, how to manage them, how to maintain them. And they're all going to walk into the clinic or be carried into the clinic looking exactly the same. There are minute details that you're going to find to help differentiate which direction you think you should go if you don't have a diagnosis. But they're all going to look really similar, and having appropriate conversations with owners about expected outcomes, I think, is a huge thing we have to remember when we're treating patients. Because, you know, saying, oh, I think it's this, and we see really good outcomes, and then in 3 months your dog is no better, maybe worse. You have to be able to have those conversations that say, okay, maybe it's not that. We need to talk about this. We need to talk about what our real expectations are. Because how I treat a degenerative myelopathy dog is similar, but honestly pretty different. I'm going to use the same tools, but I'm going to use them in a very different way than I treat a back dog. So it's
and
really important to know.
yeah. And I think that you've really hit on kind of the crux, is that our expectations and our communication with the owner is their expectations, having those as correct, right? As close to the truth or the outcome that is expected, because we can't map, like we will never be able to say in 3 weeks your dog will walk, but
Yeah.
having it as close as possible is, that's where we get compliance from our owners, and where we get their buy-in, and where we get the best outcome for their dog. Because if they're not bringing their side at home, then what we do is at the end of the day a losing battle, right? They have to be buying into all of it, every part of it, and without having a clear idea and expectation, we're going to lose them somewhere. So yeah, that's such an important thing. Like, yeah, really different conversation between an FCE and a M, right?
Yeah,
So
very different.
yeah. So guys, please do share. If you have any questions, let us know. Ashley, thank you. Hi, Ashley. So any tips with encouraging normal range of movement in the hind legs when the legs are having muscle spasms, if that makes sense? They become rigid in movement. We have found controlled swimming has shown free range of motion, but interested to know your thoughts. Oh, I love that.
That's a really good question. And one of the conversations I have with my staff and my assistants, and even the veterinarian I work with all the time, we all have slightly different approaches to how we manage those. That rigid stage is a super common stage when we're getting neurologic recovery, especially after back dogs, like the dachshunds, the intervertebral disc disease, acute trauma dogs. We see that limb paralysis, and then all of a sudden we get that muscle tension that comes in, and you're trying to do range of motion, you're trying to get them to move, and the leg just locks up. And how do you get them to move, and how do you get through those muscle spasms? I'm a more of a patient person. I'm a more waited out type person. I do think that we tend to want to force them into moving. Like, you should be moving your legs, you should be moving your legs, you should be moving your legs, which is important. But I also think that you have to give the body time to process the signals that it's getting, right? You have to give it time to process the toxins and stuff that are built up in its muscles from not getting good range of motion, from sitting around doing nothing. They've got myofascial trigger points, and they've got tension and lactic acid and things like that built up in their muscles that are tight. And, as you're trying to move them and get blood flow, the muscles are going, oh gosh, I don't know what to do. And they're tight and they're spastic. And so I'm a bigger proponent of massage and kind of stretching to get them till their muscles relax. I like to let them kind of spasm, as long as they're not painful. I've had a few dogs where they can feel the muscle spasms and they're super painful. We change up our medications as well as they need, as they go through recovery phases. We may need a muscle relaxer. We may need to increase our gabapentin or amantadine or whichever kind of neuro medication, nerve pain medication that we're using at the time. We will change them throughout their recovery as they need, as they get sensation back, as they start having those muscles that are going, I haven't been doing anything for weeks, and now you're trying to get me to stand, and I'm weak and shaky, and then now I'm going to spasm and get really tight. So I think changing up your routine, massaging in the water is important. Very gentle stretching with the muscles. I know we all, when we get Charlie horses, we all want to stretch against them really, really tight, because you're like, stop, stop, stop. But I really feel like you have to kind of massage with the muscle and relax with the muscle itself, kind of let it spasm out, let it get it out, and then push through it, then forcing them through. I also think when you have muscles that are super tight and spasm and you're trying to wrench them closed, because you're like, okay, we're just going to push against it until it let goes, you really risk doing other damage to internal soft tissues. Because as that leg acutely let goes and you go and squish things together, are you straining ligaments and tendons inside the joints that are being affected? Muscle tone is a huge thing when we're talking about recovery after neurologic disease. And so we have to be careful with pushing them too hard. But, you know, I think it's okay to have days where you're like, okay, we're super stiff and spastic today. We're not going to focus on as much actual motion as we are massage and stretching and getting through that stage till we get on to the next one.
Yeah, I really, yeah, I love that. And Ashley, if you let us know if that helps. But if you need more information, we actually have a really awesome webinar in our members portal, The Influence of Aquatic Treatment Environment on Neuromuscular Tone. So specifically focusing on addressing tone with hydrotherapy. And Amy Hesbach was that lecturer, and that's actually one of our previous Vet Rehab Summit webinars, which is super cool. Flashback to Vet Rehab Summit, I love it. So if you want to really dive into that and yeah, I think get an understanding of the reason, like why is the tone changing, and then how you can address it. That's a really good resource to go to. So yeah, do that, watch that one, and let us know if you do and what your take-home points are. It's always great to hear from you guys when you dive into our library and watch something from previous years. It's so exciting to hear how that's still relevant and what you kind of take out of that. And I think it brings me to kind of my next question. In our last webinar with Angela, she actually spoke about swimming to walking and having that, you know, the gait pattern is different swimming of the dog when it's swimming versus when it's on land. And not so long ago, it was quite a big discussion that we were having in the hydrotherapy community. Can you actually use this gait pattern that the dog has when it's swimming to rehabilitate a functional walking gait pattern on land? So I'd love to hear your thoughts on that, Sarah, if you want to, yeah, dive into swimming versus, you know, from swimming to walking and how we do that. Yeah.
I think that swimming is a very, very important part of recovery for so many things, right? Anytime we can take weight off of traumatized joints and tissues is huge. You know, we have these back dogs that come in post-surgery that have had fenestrations on either side of their surgery points. You know, basically they've been cleaned out, so now they have this empty space that has left room. And now you want them to walk, and their back is almost not stable. You know, it's loose, and there's more space for things to move around. You have to be super careful with them. We don't want to, and a lot of these dogs have more than one spot, right? It may have been this little disc space that caused the problem now, but the 2 or 3 on either side become a problem. And so we have to be super careful with them. So taking that weight off and keeping them as straight as we can and kind of encouraging them to use their core muscles without overstressing their spine is huge. And so I'm a really big proponent of swimming. I also think swimming plays a big role in encouraging them to start having motor function. I think one of my favorite things from some of the neurologic, I think it was Hesbach's lecture actually, was how we encourage motor function to start, right? By stimulating them, using that almost fear factor of, when I'm swimming, if you tilt me to the side and I think my ear's going to get wet, oh my gosh, I'm going to start moving my legs to push myself back. You need that adrenaline, that anxiety to kind of force the brain to start telling the body what to do. You need that stimulation, you need that interaction to get them up and going. And it's horrible. One of my vets that I work with is always like, you're scaring them, they don't want to walk. And I'm like, well, they're being stubborn. And so if that's what it's going to take to start those legs moving, then I'm going to get some ears wet. It's going to be okay. You know, so I think those aspects are super important, but I also think that you have to have weighted weight bearing. I mean, you have to have walking, an actual weight bearing option to get them into normal function. Again, we forget about the occupational therapy aspect of it. if I don't have training to do the things I need to do in normal life, how am I going to get there? I can't take swimming and climb a mountain. You know, swimming doesn't teach me how to get on and off the couch. It doesn't teach me how to get up and down the steps to go outside and go potty. It doesn't teach me how to posture and hold myself up to go have a bowel movement. It doesn't, you know, I mean, we're talking, that's basics, right? Not even talking about like, oh, I had an FCE and now I want to go back to doing agility, because why not? You know, and so if I go from swimming and I have my core strength is great and I have range of motion, but if I don't have weight bearing, I can't build those structural stability muscles that I need to support myself so I don't injure something else, right? Do I blow a cruciate because I haven't been weight bearing, and now those tendons and ligaments need stress to stay strong. If you don't use it, you lose it. And so that's one of her Hespeck's tendon and ligament lectures. Hers are seriously some of my favorite. I absolutely loved them. They're
She's
wonderful.
brilliant.
She's phenomenal. Seriously, absolutely loved listening to them. And you know, we have to have that weight bearing to encourage stability, just normal function, because we risk other injury without that. And so I tend to do both. I tend to use swimming. I use my underwater treadmill, and then I graduate to doing more stuff on land, you know, and the resistance I get from being in weight bearing and moving is huge, the muscle function. So I think both are very, very important, but I'm a firm believer that you have to have weight bearing, and you have to get back to how do I practice what I need to survive, right? I can't swim through life, so I have to be able to walk. And so I wish I could. I mean, that would be spectacular. I have horrible arthritis in my knees. I have those luxating patellas. It's crazy. And I mean, that would be phenomenal. I love getting in the tank with my patients and swimming with them. It's been great for me. But, you know, we have to put all of our body weight on our joints and balance. So it's important to have that weight bearing. So I do think they have to have some amount of walking in the water, not just swimming.
Yeah, I really like that. I think you're completely on it there. Like there are so many benefits to swimming that make it a great modality for us to use, but we cannot use only swimming to rehabilitate a dog to function. We have to have those functional movement patterns, the functional weight bearing, and reteach that occupational aspect of it, like you keep saying. So so my kind of thought in terms of swimming to walking is you can use swimming as a part of your toolkit, but you cannot use only swimming. If you had to and you can also do it without swimming. So it is a great tool, but it isn't a necessary tool. You can do it without. So okay, awesome. Michael, this is our last question, I think. So, Michael, thanks for joining us. Awesome to have you. So not a neuro, but an orthopedic question. Vet was asking me, how does an amputee patient benefit in the underwater treadmill? So pros and cons of an amputee in the underwater treadmill. Do you want to take that on, Sarah? That's a big question.
That is such a big question, and I feel like such a controversial question, oddly enough. Like, some people are so anti-underwater treadmill for amputees. And I think, and I don't know, and maybe this makes me frustrating for some people because, again, I'm so not a protocol person. Every treatment I do so individual based. I do have tripods that go in the underwater treadmill. I do, you know, because a lot of them have other issues as well, right? If I'm using the underwater treadmill just because as a new amputee and we need to teach them how to walk three-legged, because going from 4 legs to 3 legs, the dogs and the cats do great, right? Like, they figure it out. They're brilliant, but they tend to have these weird compensation movements. And so if we can, from the get-go, as soon as they're amputated, teach them how to appropriately walk three-legged, so that hopefully we can prevent those long-term three-legged issues when they show up when they're 15 and now they have awful lower back pain, or horrible neck pain from overcompensating for such a long period of time. Bonus, better for us to catch them from the beginning. So I am a huge proponent of going for PT as soon as they have that amputation, no matter their age, to try and get them in that normal plane of function and to use those 3 legs as much as possible. And I do use the tank for that. I think a lot of it for me is not necessarily the treadmill, but standing in the water and encouraging them to move appropriately. So I use hydrotherapy not just for the act of actual swimming or actual walking as much as it is that standing and positional movement, how to stand, how to shift my weight properly and feel comfortable. And I can adjust the water and use weights or life jackets and things to help with that. Once I do get them moving, I actually have a German Shepherd right now who's been a tripod since he was 3 months old. The shelter amputated his rear leg because it was broken, but didn't pay attention to the fact that he had horrible hip dysplasia. Horrible. I think some of the worst I've ever seen on a young dog. And so the owner pursued getting a hip replacement. And so they actually like flew a surgeon in from Italy to do this like crazy tripod, super dynamic hip replacement for this German Shepherd dog who at 12 months old weighs like 90 pounds thin. He's a beast. And he started with me before his hip replacement just to try and get him comfortable. And he had to be in the water. He couldn't actually stand up on land because his hip was so bad. His back end really didn't work. And so I had him in the water and I used a tripod harness to hold up his back end and kind of support his belly a little bit and really just focused on getting his core strength appropriate, doing some very minimally weighted on his front end activity to encourage him to straighten out his back as much as possible and get his core strength up so that he can actually lift his pelvis up enough that he could get his leg underneath him. And then once he had his leg underneath him, it was really about, okay, getting his gluteal muscles and his psoas and everything to pull the right direction to keep his leg remotely straight without putting it in a position that it was just going to pop out all the time. And he went from not being able to stand up at all to climbing up a mountain of peanuts, you know, of the physio rolls, to doing sit stands on a trampoline, to going over cavalettis, you know, before he even had his hip replacement. He had his hip replacement. He actually just started back in PT, but the hip replacement failed 4 weeks after, so he had to have an FHO. So now I have a tripod, 1-year-old German Shepherd who is not overly socialized because he's a COVID puppy and a very injured puppy, with an FHO on his one rear leg. And that dog gets in the treadmill like it is the best thing he's ever done in his life and absolutely adores it. But let me tell you, that 90-pound German Shepherd walks like 0.8 miles an hour and gets numerous breaks. And we do a lot of exercises in the tank, you know, to work on weight shifting and range of motion and things. So I, you know, I use the treadmill, but I also use it just as a place to practice exercises in the water. And so I think that we always want to separate like, oh, is it treadmill or is it not? And your tank is a pool as well. You know, it's a place where you can do exercises without putting weight on them. And I think we forget to add that in. And again, every patient is different. I mean, he couldn't stand up on land. It wasn't going to happen. He just literally scooted and shuffled himself around. So I had to put him somewhere where I could get him in the proper position to even start moving. But I think that the treadmill can be great, but you have to be willing to think of them as a tripod and not as a normal dog, right? Your water levels your expectations are different. Your speed expectations are different. They're going to need more support than just sticking them in and asking them to walk. They're going to need a lot of training on how to move those legs appropriately. So you're going to have to adjust. So again, I guess it's kind of not a specific definition. I'm not a yes or no person.
No, I agree with you completely. Like I don't think there are so many. I mean, if we just look at the conversations on hydrotherapy that are happening, it's so often people are saying never this, never that. And it really, like, every time someone says never, I go, but I could do that with this kind of patient or that kind of patient safely,
Yeah.
well,
Or I have
and
done it with this patient and have done it with
oh,
that
yes, or I
patient.
have to. Yeah. No, exactly. So to achieve this goal, specific goal. So it's always about the individual patient. What do they
Yeah.
need? What do we need to give them to be able to reach the goals that they need to achieve? So um yeah, so I really love that you shared that case of the shepherd, because that's a really hard case. Like, that's really challenging to deal with, and it's going to be, is this going to work, and is that going to work, and you guys are just going to keep trying things until something works. But Michael, I do have there are some resources in the small animals members portal on tripods. So Marinette Teeling has a canine amputee lecture that's fantastic,
It is.
because it is all about recognizing those compensation patterns and helping them cope with them, because the
Yeah.
more severe they are, the more severe your the long-term effects will be of those compensation patterns. So that one is a great resource. And then Patsy Mish mentioned tripods in her VOP series. So you can go back to that as well and see what she said there. But essentially, the recommendation is to salvage as much of the limb as you can and to get a prosthesis if possible, because the compensation is very significant and severe.
Yeah.
No matter, like, where you amputate, why you amputate, the compensation they deal with is severe. And we need to find a way to manage that, help them through that, minimize it as much as we can, etc. And that's what it comes down to. And I think what a lot of people's argument against the underwater treadmill is that it can make those compensations worse, right? So now the dog is not only having to work extra hard in XYZ fashion, but they're also doing it against resistance, which is what's happening when you have the tread running at a normal speed. But if you account for that, think about it, look at the patient, what they're doing, you can also help them to, like, you have the buoyancy and you have the hydrostatic pressure and you have the added support. So okay, I'm not the one here to give you guys information. That's Sarah. But we've already been going for almost an hour, so that's our last question. Happy with the response, Michael. I'm glad that helped you. A thank you from Ashley and a thank you from Michelle. Guys, thank you for joining us. It's been really great having you. If you want more information on hydrotherapy and how you can use it for neurological cases, we really have amazing webinars in our members platform. And what I'm going to do is I'm going to put those links in the conversation for you. So as soon as we go off here, give me 5 or 10 minutes. I'm going to pop it in the conversation in the comments of this of this live, and you guys can go check out those resources if you want any additional information. So everything from nursing care to Amy Hesbach's webinars to Ellen Martin's. Ellen Martins is also another fantastic lecturer, sorry. And then we have some veterinarians who have given us some webinars on the different pathologies. So the common ones, the not so common ones, being able to recognize when it's not the normal thing is also really important so that we can intervene.
Yeah.
This is not an IBD. Something else is going on here. Please go back to the vet. So,
Sure.
yeah, so thank you, Sarah. I really appreciate you coming on with us today. And thanks, everyone, for joining us.
Of course. Thanks for having me.
Bye, guys.